So let me introduce Dr. Sameer Dalwai, who is joining me here on two sides with Afrida. Thank you for giving me your time. I want to just introduce you by saying that Dr. Dalwai is a well-known name in developmental pediatrics. He's an eminent doctor based in Mumbai. So just the right person perhaps to give us clarity on COVID-19. Today is the World Health Day. That's the reason I'm having this conversation with you, because you have written this article which has been published in the Press Journal. And I want to start right away by bringing up some of the points that you have made so that you can give us an understanding of why you have made those points. One of the things that you have said is that, well, you feel that even though this is expected to overrun a badly shaped health structure, fortunately and surprisingly, so far, India has done well. So I want to ask you on what basis, on what grounds you feel that so far India has done well in its fight against COVID-19.
Yeah, so good evening to you and to all people who have joined us here. And thank you very much, Afrida. It's an honor to be having this discussion with you, especially on such an auspicious day today. At the same time, in the middle of such a huge crisis that India and the world is facing. So what I've said is based on the obvious features. At the moment, if you see the numbers, and if you see the speed of incremental exponential increase in the number of cases, we are much better than what the other countries were doing 5 weeks into their first case. Okay. Now, there are two reasons for this. One is a fallacious reason and the other is an imagined reason. So the fallacious reason is we really haven't done a lot of testing. And in the amount of testing that we have done, these are the number of cases that we have seen. However, we don't know the symptomatic or asymptomatic undiagnosed people in the country. What happens is, though they are not diagnosed, each infected carrier infects is about 2. So this is what's happening, and at the moment we don't have an exact idea because we haven't tested. So whenever we have a cluster, we may be cluster testing them. For example, what happened at Delhi. So we've gone out and tested a large number of people there. So that's how the results may vary. The other reason why I'm so optimistic again, the hopeful reason as I mentioned, just today I read a piece coming out from somebody from the US who's correlated the studies from New York, from China and from Europe, and they've been saying that perhaps the way we are treating COVID is not the right way. We are treating it like an ARDS, acute respiratory distress syndrome, where we are trying to use ventilators as a very, even in fact in my article, because that was written last night.
Yes, I'm going to come to that as well. Yes, on your point about ventilators, but carry on. Yes.
And even today, this morning, I have to kind of change a little bit because this article says that the ventilator we are using may not be the right way to support this person because he does not have exactly ARDS. What this study has shown is this model is similar to malaria. What the malarial parasite does is actually interferes with the oxygenation of the hemoglobin. And the hemoglobin, as we are aware, is an iron-based protein, an iron protein complex, which collects oxygen from the lungs and takes it to all parts of your body. Oxygen. So there is something that goes wrong in COVID, which is similar to what happens in malaria, which prevents the oxygen from being carried to the lungs to all across the body, which is why we are getting
Which is why now there is this new discourse about the antibody test, and there is a tug of war over certain drugs that India has banned. Do you think this is connected to what you're saying? The sudden realization that the similarity with... Yes, go ahead.
Yeah, absolutely. So there are two fascinating aspects here. We all were thinking, or research is very clear that if you divide the countries of having COVID and what is the impact of COVID, there are clearly two groups. COVID in countries which have BCG vaccination as a universal policy, COVID in countries which don't have BCG vaccination. And they have shown that the countries which do give BCG have a 10 times better outcome, or rather the countries which don't have BCG have a 10 times worse outcome. Countries which have BCG are 10 times better. Now we don't know exactly what is it because of, it's an association. But look at it from the malaria point of view. Now we are saying that if it's a malaria-like model, one obvious part is chloroquine or hydroxychloroquine, which is in the discussion very much today, is going to be a beneficial factor because the same way it inhibits the malarial parasite the same way it will prevent this oxygen problem from happening from hemoglobin because of COVID. But the other point, Abhida, is like this, that we are a country which is endemic for malaria, but many of us don't get malaria, which means we have the malarial parasite, but our body is immune and it prevents the malarial parasite from running rampant. So maybe we do have an immunity for COVID. It's what my hope on this, doctor's day today, that somehow we are protected immunologically against COVID the same way we are protected against malaria by far, though it's endemic, all of us are not dying of malaria or were not dying of malaria. And the other thing is, I see a very great hope coming up from hydroxychloroquine.
Is that the reason why there's a sudden clamor? Because I think there is, yeah, for hydroxychloroquine, I was seeing Trump's statement saying you better release the drug to us or face consequences. So there's obviously a sudden realization, but that leads me to the question to ask you about how much is really known about this virus and how much is still unknown. Because I've heard doctors say that this is uncharted territory, we don't know enough yet. How far have we progressed in cracking and, kind of figuring out what this virus is about?
You are absolutely right. Not much. Not much. So these studies are so-called anecdotal, but we have no option because there's no time to organize a research study on this. Let's take a look. Malaria, typhoid, tuberculosis have been around for so long. We're still figuring out the best way to deal with them. So this will take time. At the moment, we are in the middle of the war. You mentioned about countries talking about hydroxychloroquine. I'm wondering whether that's the new oil that we are going to have international discussions about.
Right. That in your article, I was reading the part where you mentioned about how you can't be so archaic to, not give the equipment that is necessary. And I like your analogy about the army that you're talking about, that you would not give them swords and shields, but you will be giving them bulletproof jackets and guns, which is exactly what the doctors need. They need the PPE equipment. I'll come to the point of the ventilators now. There's a figure that you have quoted about 70,000 that India has at the moment, but you already made a point about not everything that we have may be suited for the purpose.
Well, so one fact is here is that the equipment and then the doctors. So it's the men and the machines, if I have to look at it. So on one hand, we have a huge shortage of doctors. Forget Corona, before COVID or Corona. And we had huge shortage of ventilators for the regular problems of illnesses that people had given us more time.
So let's talk about the lifting of the lockdown. How prudent it will be then, because we are just about 1 week away. And you are saying that, yes, the lockdown has been effective, the streets are deserted. Obviously, there's no public movement, and with that, the spread has been arrested. One can understand that. But for a country like ours, with its own unique socio-economic dynamics, we cannot carry on with this lockdown. There's a very tough balancing act here. And we already know the fallout of it. We've seen the migrant laborers being left high and dry. They are supported somehow for the time being. But this stopgap arrangement for the entire bulk of the population cannot go on forever. So in the overall balance of things now, in terms of lifting the lockdown, what do you think? What is your stand on the matter?
So again, incidentally, just same like any medicine. I mean, even if you take paracetamol, I'm not talking about Corona, I'm just saying generally, even if you have to take a tablet of paracetamol, we know there is a possibility of a side effect. So every medicine has to be weighed in terms of its benefit versus the risk that it entails. Lockdown, if you are looking at it as a medicine or as a procedure or as a process, it has a benefit and it will have a downside to it as well. Now, nobody has estimated the real economic, social distress that could come out of this lockdown, because we were already in a bad economic slowdown. We were in economic slowdown, and now we've been hit by this huge crisis. Even we had issues in 2008 or even in 2016, but at least people were working, our factories were working, people were out on their jobs. Today, it's worse than that because we are not producing anything and we are even not consuming things. So it is going to be very difficult. Plus, India has such a wide spectrum of socio-economic structure. I, in my house, may not be much affected, but there's somebody who may not have beyond 2 to 3 days of rations or ability. So it has to be taken as a socio-political decision. I won't go much more into that because we will have to look at the indicators of that. But what I would say is that once the lockdown is over or slows down, and if we imagine that then coincides with an increase in the cases reaching the hospitals, who is it that's going to save us? It's the men and the machines, the doctors and the equipment. In this case, not only do we need good equipment like maybe the ventilators and the ICUs, which are still machines which can be procured, which can be multiplied, or which can be produced overnight, perhaps. But what we must understand, we cannot produce overnight, is the medical staff or the healthcare worker. And in corona or COVID, because it is so infectious, if I catch the infection by treating a patient, there are three things that may happen. I may not have any symptoms, I may have mild symptoms, or I may get so seriously ill that I may die. Largely possibility is that I'll just be mildly sick. It's only 1 or 2% mortality. But even if I'm asymptomatic and I'm infected, I have to be quarantined at home.
Yes.
So the hospital loses a doctor
Resources,
or a worker for 14 days.
Correct.
So
So
it's
that's the
not
real
just the
problem.
deaths of the doctors. It's not just the deaths of the doctors. We are not afraid to die. I mean, that's an oath, and we are programmed to work.
Because look at what happened in the Wokhart hospital, and now I'm coming to the Mumbai situation because yes, there are quite a few hotspots now around the city. The numbers are rising faster than it's the district with the highest number of positive cases across India. But what I want to ask you is that in this particular hospital that I'm referring to, the nurses, and we're talking about vulnerable groups, and I remember you've said that this if you have pre-existing morbidities and if you are in the high risk age group, of course, but otherwise people can hope to recover. But there is a new vulnerable group now, I guess, which are the doctors, because or the nurses or the frontline workers, unless you give them the protection. With this, in this Wokhart hospital, 26 nurses and 2 doctors have got infected with COVID-19, and it happened apparently because they were treating a patient with cardiac ailment, did not think that he will develop the virus, and then perhaps things went wrong from there. Now, how do we avert a situation like that? Hospitals are also dealing with other cases, and then if somebody comes in and is not treated as a COVID patient, later turns out to be COVID positive, which is what seems to have happened in this case, because a lot of nurses have got infected with this because of this elderly patient. How do we avert this kind of situation?
Well, there's no easy answer, but the ideal situation, imaginarily ideal, I would say, is that every healthcare worker is protected. And it's protected not only to save that healthcare worker's life, but to keep him on the job for the next 14 days. Because if he is quarantined, like you mentioned at Wokhart, you lose the services of those people and they're already understaffed. So what we need to understand is we need to protect these guys from getting infected. That's a health care worker. And more than that, we need to train them how to use this PPE or the personal protection equipment, because not many have ever been trained in it. So the first thing is to see that we are able to produce this and procure this. It's not even about the money. I am aware of people who have given thousands of billions of rupees for that. What's very important is to work on producing and procuring the PPEs, that is the gear, training our healthcare workers how to use it correctly. And it's not just the gear, it's also how to handle the patients that you have. For example, one thing which I read yesterday is the government of Maharashtra, or at least in the city of Mumbai, 5 hospitals have been earmarked for COVID. And I also came across a tweet from perhaps the mayor of one of the cities in Italy, who said that the mistake we made is we didn't separate these two populations. Because since it's an airborne, aerosol-borne, and droplet-borne infection, even if the droplets fall on the surface, suppose they fall on some object that's there in the room of the infected patient, if that object gets carried out, it goes to another patient's room who does not have COVID, he would get infected from there. So, which is very important, and that's what the government has done. They have isolated 5 hospitals, to the best of my knowledge: Kasturba Hospital, Hiranandani Kasturba Hospital, St. George, and the 3 private hospitals, Nanavati, Selfie, and Seven Hills, which will be restricted only for COVID patients. I think the government are, running with the ball, so to speak. They are doing a great job across the country. I find people are responding. The major challenge here is to, one, be very, very so why lockdown? Because the lesser infection you spread, the lesser is the eventual load on the healthcare system, and those who eventually do get infected and go there have a better outcome. So it's a social responsibility now to prevent all kinds of congregations, whether it is religious or political or social. We need to avoid even symbolism that perhaps ends up unintentionally causing lack of social distancing and spreading. We need to be responsible. We need to understand this is beyond our everyday viruses, like, if I may use the word, social issues or fights that we have, or petty issues that we fight over, and religion and caste and caste. I mean, I would say these are the regular viruses that we have in our society, but now
That's
there's a
right.
big one who's come. So this
Yes. Right. Yeah.
very clear that one, whichever religion we are, we should not do anything that comes out in the way of management. And second, even if we do see somebody doing it, we need to handle it in a very careful, sensitive manner. The last thing we need now is a population that has mistrust for each other, distrusting each other. That's the last thing we need now.
Right. We cannot afford to have our attention diverted towards anything else except for what is necessary at the moment. We need to, of course, join forces and, fight this together. And something is very interesting about this virus is that if I protect myself, by default, I protect many others. It's like, each one is doing for the world at large by staying indoors or by taking the necessary precautions. I want to ask you about the Mumbai scenario. A lot of private hospitals are now being roped in to fight against this. But do you recommend or suggest dedicated COVID hospitals? Some states are doing it. I don't know if Maharashtra government is going to decide anything towards their end. Do you think that we should have dedicated COVID-19 hospitals? The fact that they are regular patients and COVID patients dealing in the same, being dealt in the same premises, how advisable is that?
We will have to go there. I mean, there's no two things about it. We will have to, because, like you mentioned, it's such a highly infectious problem that if we mix up populations over a period of time, it's going to be difficult. As of now, we haven't had many cases. So we've been able to manage with isolating parts of the hospital. But moving ahead, we will have to isolate the entire area. Now let's look at it. You have a patient who's carrier who's detected in a particular area. You're cordoning of that area when that person is not even highly symptomatic or ill or critical. Imagine in the hospital, everybody is critically ill, and imagine the viruses which are being shed. So if you look at isolating an area so that you don't want infection to spread, obviously you have to have the entire hospital that is isolated.
Yeah, and before, I mean, in my concluding question, obviously, since you are dealing with developmental pediatrics, I must ask you about children, and you also deal with a lot of mental health issues with regards to children. So during this lockdown period, as a mother of two, I have to ask you that what are the things we need to do for our children, and how do we keep them safe? How do we make sure that even by mistake they don't get exposed to the virus? What are the do's and don'ts for the kids?
So, well, if they're indoors, then there's no chance of them getting exposed to the virus unless somebody in the house has that. But let me say, tell you what I was sharing with one of my patients today. All of us were permanently guilty, and working mothers, I'm sure this is a pet peeve. All of us are permanently guilty, even fathers, that we never get time for our child. Well, here you have. There's a silver lining in every dark cloud. You have plenty of time. This was unenvisaged ever, that parents would get so much time at home with their kids. And what we need to understand is this is so. For example, let me come to my pet topic of my pet passion about autism. Autism is, according to me, a problem of social interaction, and that's my hypothesis. It's caused because of a lack of social interaction. Now, this is perhaps the best time for a 2-year-old child or a 2.5-year-old child who was having poor social interaction. Family was busy, nobody had the time to spend a child with interaction. He was on a mobile all the time because parents had to run off for work and had a hectic schedule. I would say this is a great opportunity for children with perhaps autism, because at home they will get so much more of social interaction. And it doesn't have to be only for children with autism, it's for all of us. Everybody loves affection, and the other word for affection is interaction, because you only exhibit affection through interaction. Just spend time interacting with your children. And with children, remember, interaction doesn't mean we talking much, but it's letting the child talk much, especially the older the child gets. You talk, the theme for parenthood or parenting is gradually talk as less as possible. Once your child starts talking, and then listen rather than speak.
Right.
And that's a very important thing that parents must practice.
Right. I'm sure there will be new, we all as parents discovering and rediscovering, reinventing bonding exercises with our children, having to live through this period of confinement. So I'd like to thank you so much for joining me today on Two Sides with Afrida. Thank you so much for giving me your time and your valuable insights on so many different issues. And thank you for all the service that you do for all the people around you and the good word that you spread on how to conduct ourselves during this difficult time. Thanks a lot. And have a good day.
Thank you very much, and wishing all of you a very safe next 2 weeks and months and a very great and happy life ahead. Thank you very much.
Thank you. Bye-bye.
Bye.